We went to West Nile. We found government has bought machines which are in Kavera. Do you know buying sophisticated machines like the ones I'm seeing in this studio here? And imagine there are no technicians to operate them. You, the presenter, how are you going to present? So we found machines, anesthetic machines, brand new. We had brought experts. They opened them. They trained the local staff how to use them, because staff were saying we don't know how to use them. We are not enough in number. So having said that, how can you be the same government saying interns are many? You are seeing what I'm saying? I'll give you an example. Yes. You go to an area, they tell you this ENT machine was bought 10 years ago. Why haven't you opened it? There is no ENT surgeon here, otolaryngologist. An aesthetic machine, it has been here, brand new, very good. The specialists were saying, we don't even have this one in Mulago. Yeah? It is here in Arua, it is here in Yumbe, but nobody to operate. So how can you be the same government saying that the medics who have been trained are many?
And welcome to the Policy Digest. So today we're going to look at an issue that is not just about a profession, but it's something that affects every Ugandan out there. So Uganda is one of the youngest populations, I could say, with over approximately 46 million Ugandans. Now, we need to look at the doctor-to-patient ratio. Now, the doctor-to-patient ratio is 1 to 25,000 Ugandans. To break it down, for you to be able to understand, I need you to look at, let's say, a stadium that maybe can take up to 5,000 Ugandans, say, let's use like Nambole. So that means that for Nambole to be full, Uganda will only send 2 doctors. So that is like to paint a picture of the reality of how our medical is, in terms of how you can access a service medically and how immediate a doctor can reach out to you. He has a line of 25,000 patients. Now, back to the issue. The ministry tabled a policy that is to determine the future of medical internship and medical training in Uganda. But as we're going to start and get into this discussion, I want you to have a food for thought and wonder, so what happens when the people who are supposed to look out for the medical training in Uganda and train our future doctors are unable to meet halfway and agree on how the training should happen? Who is right and who is wrong? That's a whole other different discussion. And as we get into this, I want you to also ask yourself, what is at stake with this policy being put into place? And to dive into this, I am joined by Dr. Ekwaro Obuku. Thank you very much for...
You're welcome, Safari. Good day to the viewers. And I'm happy to be in this show for the first time at the Center for Policy Analysis, particularly because I did my PhD in policy-related work. And I'm happy to attend to this matter here.
Thank you. So as we get into it, first make us understand who is an intern, because it has been one of those things that everyone is asking, and also in the policy itself, the contentious point is internship, medical internship. So make us understand who is an intern in Uganda in terms of the medical world.
Okay. Maybe before that, people may wonder who is talking. Maybe let me introduce myself. I'm a medical doctor by training. I did my internship in 2003 at Arua Regional Referral Hospital. I trained at Makerere. And to do my internship, by the way, I took a plane from the airport to Arua. I was not a WHO consultant. I was not a government consultant. I was the mere student, as they call us, who had graduated with 2 degrees.
2 degrees.
Bachelor of Medicine and the Bachelor of Surgery. Maybe next time I'll come with a certificate here to show you that the certificate reads 2 degrees. Bachelor of Medicine and a Bachelor of Surgery. It takes 5 years to study at Makerere. I was also the president of the Medical Association, various leadership positions for about 10 years. And during our time, we did a lot to start the policy reforms on how civil servants in Uganda are paid. We started with the doctors, they moved to teachers, they have moved to other scientists, and now they have moved to the cows and RDCs and so on. But we are the ones who started it because we told the president that enough is enough. The government had stopped recruiting doctors. They had put a blanket, no mass recruitment, receiving wrong advice from the World Bank and the International Monetary Fund to do structural readjustment programs. Don't hire civil servants. But in their countries, in the US and the UK, government is the biggest employer. China, which moved to the left, is the biggest economy today. They just didn't listen to that wrong advice of what I would call economic hitmen. Okay? And this is the same attitude because our economists are trained in the West. They come with something called the Baumol hypothesis, that health is a consumption and not an investment. So the intern doctor, I'll talk about, there is the nurse, there is the pharmacist, there is the dentist. Those are the 4 categories.
So when we are talking about intern doctors, we are not just talking about only doctors.
They are the intern doctors, the true doctors, the original doctors. The dentists who do 5 years like us, and the medical doctors who do 5 years. Then there are pharmacists who are also now
doctors,
calling themselves doctors. Okay? Traditionally, it wasn't the case in Uganda, but they cited other countries. They call themselves doctors, and also the nurses, who also some call themselves doctors. We are not selfish with the title, but we wanted to distinguish that among that category, we are the only ones who have the skill, the knowledge, and the legal locus to operate mothers and do any other operation, whether it's the throat, a hernia, the ear, the eye, ophthalmologists, or obstetricians, or general surgeons, or neurosurgeons. That's the MBCHB 2 degrees in 1. Now, this doctor is qualified, by the way. I told you earlier I'm in law school. When I finish my 4 years, I will go to LDC, Law Development Center, do that diploma from 8 to 5. I go home with a lunch break. I'll get a diploma. Okay? Which is a professional but also an academic qualification. In this medical internship, I don't get any paper. I already got my MBCHB. So I'm not a student. I'm not registered in any university or any academic institution. Law Development Center is under Makerere University. Internship is under Ministry of Health. Already you have started working. And just to take back to history, intern doctors were captured under the public service structure. Someone somewhere just became malicious and removed us from the scale of U5. Those days, it was 500,000 by the time I was coming on board. The intern doctor works 25 hours a day, 7 days a week. some calls. When you say
So
you're
they
on
work
call,
Monday to Sunday.
they work Monday to Monday.
Monday to Monday, yes.
I'm being metaphorical here to tell you that you're like what we call a kurutu in the military, a recruit. You have no rest. You have no lunch hour. You have no weekend. You have no World Cup. You get what I mean?
Yes.
If you can manage to finish, then you can watch your Arsenal winning the cup or losing the Champions League. If you manage to finish. Many a time you have just finished like this, 5 o'clock, you want to go for lunch, a truckload full of road traffic accident victims come. You are the one to sort out that truckload, call the seniors where you need help. You may leave that place 5 a.m. the next morning.
So just to have, you said that medical interns work Monday to Monday, literally almost all hours of the day where needed. What does that mean for our other doctors? Because I presume, or even other Ugandans presume, that before the medical interns are taken in, we have doctors. Where are those doctors when the interns are working Monday to Monday?
So, very important question. By the way, that work, even if you pay the intern, the way they work is slavery. Even if all conditions are right in terms of we have the money, they have all been deployed, which is what we're asking for. 2 things. The money. In fact, when I hear they are paid 1 million, it is a joke. We are asking for 5.5, which is the starting salary of a doctor.
In Uganda.
In Uganda. Then, the deployer of them.
So as of now, all of them are not deployed?
That one was solved last year by Dr. Olaro Charles, who is the one who took me by plane. In 2003, was the director of Arua Hospital. So he is good employment record. The very good employer, that Dr. Olaro Charles is the Director General Services. He said that during his time, he does not want a strike by interns because it's perennial, it's useless. So there are other doctors of this category. Once you finish internship and you're employed by government, you become a medical officer and you can graduate to a senior medical officer by promotion, to principal medical officer by promotion. The other route you can take is to add qualifications. Masters of Public Health, you go and become a DHO, District Health Officer, instead, and you're head of department. There you are at the level of principal medical officer. Masters of Medicine, in surgery, obstetrics, ophthalmology, ear, nose and throat, neurology, surgery, general surgery, internal medicine, nephrology, and so on, all of those, cardiology, the heart, gastroenterology, the liver and intestine. Okay? Fertility medicine, those are now specialties and subspecialties. You take that route. When you are studying, you're called a senior house officer. We explain to the president that is equivalent to SFC, Special Forces Command in training.
In training.
But our training is saving lives. Then we have the consultant and the senior consultant. Now, the way they work is, as the President Dr. Rwabinda, our president of UMA, explained, the interns are at the base, the majority. They sort out quickly the minor cases. Okay? Someone has got a road traffic accident, just needs what we call a STS, where you clean up the wound, where there are cuts, you can put just plaster, or if the cut is deep, you need to stitch it or to suture it. They do that kind of work. But also they will handle major surgeries. That would be routine, like saving mothers through cesarean section, pregnant mothers.
So intern doctors can't do that?
Yes, they're even trained. Okay? They will come and save it. And the last time we checked, on average, an intern doctor will do at least 50 surgeries of pregnant mothers in 12 months.
So from that,
The one who is dodging will do at least one a month, 12.
So by the time they finish their
By the time
internship.
they finish. And there you have really dodged, because a minimum you would be able to do is one a week, which gives you 48 to 52. So the last time we talked to the president of Interns, Dr. Mwanda, he had done 56. When you ask people, they have done in 50s, above 45. But they are also entitled to leave 2 weeks every 6 months. And that's what even makes them employees. There is no student who gets leave. They get holiday.
Yes.
So they are not students. They are employees of government. They are given contracts. And as you know, in law,
Yes.
there is that intention to establish a legal relationship. Okay? Yes. When will you get, according to the labor laws of Uganda, the Employment Act, the Labor Unions Act, the Public Service Negotiation Machinery Act, they are all captured. The Occupational Safety and Health Act, they are all captured in that contract. So for government to go and say, no, these are merely students, government is shooting itself in their foot.
Okay, so I have 2 follow-up questions on that. The first one is, from your point, are you saying that with the work that interns do, the fact that they have already graduated, they qualify as to be employees of the government while they're doing the internship, and government is dodging to pay its employees? Exactly.
They don't even qualify. They are. As you know, contracts can even be unwritten.
Yes.
You get?
Yes.
But they issue a contract which you sign. There is no student who signs the contract. You just get your admission letter. So, isn't it?
Yes.
Yes, but here you sign, it is also countersigned by the government representative. So even if we are not in the public service structures, we should be anyway. We go by the public service standing orders. That's what they tell us in the first 2 weeks of orientation. There is orientation. Someone will come from the Health Service Commission
to orient them.
To orient and tell you public service is like this. Dress code Monday, Friday, da. Okay? Someone will come from Ministry of Health, Human Resource. Someone will come from clinical department to tell you how you should behave in hospital and the professional guidelines. Someone will come from the Medical and Dental Practitioners Council, which is founded by government. Other health professional councils for pharmacists, nurses, okay?
Yes.
Will also come. These are government entities. They are addressing students.
So it takes me to another point. In the policy, they want to make they want to make graduation happen after internship. Help us understand what that means for the fact that medical students or medical interns, doctors, would have to first do the internship to be able to graduate.
Okay. Thank you. But earlier you had asked me, how did we get here?
Yes.
Government was sleeping. Government is so interested in politics, has invested in politics so much that the return on investment in politics has been such that it has sequestrated the money for development programs. That's why we have to borrow recurrently, even if we have doubled and tripled our revenue collection.
We still have to borrow.
We still have to borrow. Why? Because so much money has gone into politics and in many instances delivery of air, such that the priority of priorities are not invested in by government. They are invested in by borrowing. Get what I mean?
Yes.
If we are to cut down on wasteful expenditure, as the PSST, Dr. Ramadan Govi says, no more celebrations, 24 billion. Why do you give MPs 315 million, yet the last lot got 200 million to buy cars? You have added another 115 million. If you multiply that by 500 MPs, I'm sure you are saving over 50 billion.
So are you saying it's more of a political...
So we got there through wastage. We got there through political slumber. We got there through political rhetoric. The president is giving policy direction. The ministers are sleeping. And the other policy actors are sleeping. Okay? So government is abdicating from its duty to develop the health sector. The health sector cannot develop without human capital. That is why government buys machines. I mean, we have been doing regional camps through our doctors' associations. The Ugandan Medical Association, the Association of Surgeons of Uganda. Every year you come a region. We've come the Bukedea region, Bukedi, supported by the speaker, the past speaker. We've come the Lango region, supported by the minister. We also come the West Nile. We have come the Ankole region. Okay? We have come the Bunyoro region. By combing, meaning you go there and you clear like 5,000 cases of surgery.
Yes.
In less than 2 weeks. You go and clear all complicated cases in medicine. Let me give you an example. Epilepsy, which is recurrent. The person is getting treatment, is not improving. We bring the top consultants, neurosurgeons. One of the past presidents of UMA is called Professor Ido Richard. He's a specialist in that. We bring all of those specialists. I remember in Arua when we went to West Nile, in Arua, 2 things I observed. There is a mother who went on the main street of Arua screaming, "My child has been here 10 years, has never seen a doctor. Today I've got a doctor free. Orthopedic surgery." Very important service, government almost gives nothing.
What does that
Broken bones.
What does that say about our health sector?
It means it's not a priority of priorities. What service are you delivering to the people if the kitchen is dirty? If you can't take care of health, what are you doing?
But then the ministry says, the ministry says that the medical interns are too many. Could you help us understand what they mean by the medical interns are too many for them to be able to facilitate them?
I'm coming to that one.
Okay.
We went to West Nile. We found government has bought machines which are in Kavera. Do you know buying sophisticated machines like the ones I'm seeing in this studio here? And imagine there are no technicians to operate them. You, the presenter, how are you going to present? So we found machines, anesthetic machines, brand new. We had brought experts. They opened them. They trained the local staff how to use them, because staff were saying we don't know how to use them. We are not enough in number. So having said that, how can you be the same government saying interns are many? You are seeing what I'm saying? I'll give you an example.
Yes.
You go to an area, they tell you this ENT machine was bought 10 years ago. Why haven't you opened it? There is no ENT surgeon here, otolaryngologist. Anesthetic machine, it has been here, brand new, very good. The specialists were saying, we don't even have this one in Mulago. Yeah? It is here in Arua, it is here in Yumbe, but nobody to operate. So how can you be the same government saying that the medics who have been trained are many? Let's talk about the pharmacists. You are hearing drugs disappearing, drugs expiring. The district has no district pharmacist. You're getting me? There is no person in charge of drugs at the district. We have DHO, we have maternal child, but the critical commodity which someone complains about, or which brings someone to the facility, medicine, is the person in charge is not there. Government has done good things like through this PDM extension at the sub-county level. They have said doctors will be there. The other thing, remember, Uganda has the youngest population. Do you know why?
Why?
It is the fastest growing. People are producing a day and night. Okay?
Yes.
So if people are producing a day and night, we go to politics. The ratio, there used to be 80 MPs. That parliament is constructed for 80 MPs. Now there are 500 and 30 or 29.
Yes.
Over 6-7 times increase. They used to earn 3 million. My uncle, Honorable Kuli Park, the one who removed graduated tax, or Yam South MP, very, very intelligent engineer. They were earning 3 million. Now MPs on average, at least 30 million. They have increased 10 times. Their number has increased. Cabinet used to be around 21. Now they are 8. They used to earn around 2 million. Now they're earning 28 and above. So how can you say when it comes to service delivery, they are too many? How come we are not complaining about the political leaders who are too many?
And their resources are always
Let's
available.
look at police.
Yes.
Police used to be less than 20,000. Now they are over, I think, 40,000. Let's look at the military. Even they don't want us to look at their money. It's classified. Tell me how many people have died from war in Uganda. Tell me how many people have died from diseases. You see what I mean?
Yes.
We are here, the whole country is shutting down, the economy is not moving. Why? Because there is a war. Because there is Ebola. So even us, we die in that line of duty. Dr. Muhammad Ali, a student, doing his Masters of Surgery from Kampala International University, deployed to this regional far-ops called Mubende, was the first casualty of Ebola in the health system. Have they even ever given him money according to the Workers' Compensation Act?
Have they?
You get what I mean? They have never. His family lost him, but he was operating a patient who unfortunately had Ebola. But because he was he was spitting this blood, they thought it was a bleeding ulcer. You get what I mean?
Yes.
Because the first few cases, really, you get lost. So what are they telling us, this government?
So to understand what was government, what was behind the people who were making this policy? What problem were they trying to solve? Was it?
They were trying to solve the problem in their heads. Because numbers cannot be a problem. Every time Museveni is telling women of Uganda, produce. Because when you produce, especially if the middle class produces, we have a market to consume. Once we produce and we take them to school, UPE, USE, if it works well, then we have a highly skilled population. The future of this world, the industrious world, is in Africa. You are saying sciences. You have got this blessing of scientists. And even artists are important, by the way.
Yes, of
Yeah?
course.
But much as I'm talking
important.
here, parroting government's program, even artists are equally important. And I'll tell you, look at Apple, the first company to be $1 trillion worth, is made by scientists, the engines and what. But the appearance, which attracts people, the sound from an iPhone, the way, the aesthetics, that is art.
Art.
We cannot do without art. The national anthem is written by who? Which we sing, oh, Uganda, may God uphold. East African anthem, written by who? The flag, the emblem. Is it scientifically drawn with the protractor?
No, it's not.
So please, it is a high time that if government, I like what President Bukele said. President Nayib Bukele of a South American country. I'm not sure, but I think it's Ecuador. Young man, I think less than 45. He has just opened the third most sophisticated hospital, North and South America combined. And it is free. And he said that if stealing by government officials stops, there will be enough money to move around for everyone. Let me tell you about ideological corruption in the health sector. Why should we pay 300 billion shillings from taxpayers for the top leaders, i.e. MPs, ministers, top government officials with access, UPDF, to go abroad? From taxpayers money. Why should this government parastatals get money and pay for private health insurance, including URA, scandalous, NSSF? They are getting taxpayers' money taken to the private sector and saying, for health, by the way, and saying now you, the ordinary woman selling tomatoes whom we are chasing from the street and taxing indirectly because she buys the fuel, she buys the matchbox, she buys airtime, she pays her tax in that form, indirect taxes in the informal sector. For them, they can go to Mulago and something is missing and it is okay. So we are not saying that the private sector should not be there and should not be promoted. We are not saying people should not go abroad. We're saying, okay, if you're a minister, okay, we are giving you 30 million. Part of the deal is that 30 million should be able to take you where? Abroad out of choice. Otherwise, there should be a policy that the moment we give you that car, the moment we give you that fat salary, They want to give you these other allowances. Please come to Mulago for healthcare. Because once the president and the president's children, can you imagine the first lady coming to Mulago? How everybody will make sure the medicine is there. First of all, the first lady is coming, my friend. You get what I mean?
Yes.
The president is coming for checkup. On this day, my friend, the place will be clean. And the president used to do unannounced inspections, by the way. There is a time he came to Mulago and passed the other side up. The hilly part. My friend, down there, people are preparing, calling each other, but he found mothers on the floor. Those are the things we want the president to do. Do unannounced visits to these hospitals. First of all, you will appreciate what is on the ground. Is the money trickling? What your directors are telling you, you will appreciate. If the director of Mulago tells you there are not enough medicine, you will appreciate. But this business, you are in the lounge of airports. You are in the air condition of State House. Or a ministry. Because now the president is old, of course. But the lieutenants, vice president has energy. You can see the prime minister, very energetic. Those ones should not only go to roads. They should go to these hospitals and follow the money. But no government official should ever say interns should not get money. My friend, if any minister says that, let them just spend a weekend with an intern. They will appreciate that an intern is the most hard-working employee in the government of Uganda.
Maybe we should task them to actually do that. Spend a week with interns.
Those ones who are doctors, like my senior comrade Bariomusi initially was saying, interns, we don't care about them. He has been captured on TV. Let Dr. Bariomusi come back and do internship at Kawempe Hospital one weekend. I am very sure by the time he's finishing in 24 hours, he will be calling Ramadan Gobi. He will be calling the speaker Oboth, that please can you release the other money so that these people are paid. It is that lack of appreciation, the detachment. You know, the government has been around for 40 years, re-electing itself. It's being announced. So they have become arrogant
in what they are doing.
By the time, and this thing, I want you to look at it this way. It is systemic. By the time you start chasing these people from the streets who are earning nothing, okay, they have left the streets. You go and start bombarding their kiosks. You get, yet you are the one who approved. You are going to destroy houses of the poor, yet they have the land titles stamped by your same government. Meaning there's uncoordinated movement of troops, there's disinterest in the common man, and this can only happen when the government, people are running the government, they have become complacent. They have lost touch with the reality. I challenge Mr. Museveni, His Excellency, who has said, "Time no sleep," to come down to the bush where he came from. The people who died for him to be president and his family to enjoy also. Yes. Come down to them and understand the plight. They're going to think the president's daughter, Angela, is a doctor. But of course, she didn't maybe study here and so she may not appreciate the system. The
president has a daughter.
Yes, has a daughter. Angela. We know her very well. If she, let the president give her this to be in charge of this internship and give her the truth of the report.
Okay, now
this one, he will get direct and filtered information. And many of these people, the speakers, those deputy speakers, they are owning medical schools. They know this. The Bariomusis. They are sitting in this King Caesar University. Right, so they know what is going on. Why should they not advise the government properly with the energy with which they campaign? When it's campaign time, promises are all over the place. Okay?
Yes.
Sciences, securing your future, protecting the gains from where? Which gains are you protecting?
Hold the thought. Are you going to take a short break and then we shall be right back? So thank you for watching. We shall be right back.
Welcome to the Parliament Performance Tracker platform, a portal designed to empower Ugandan citizens with valuable insights into their parliament's performance and financial landscape. Some of the key highlights of this platform include the Parliament Legislators Report Card, Here, you find comprehensive information on the members of the Ugandan Parliament, from contact details and their biographies to their legislative performance, including bills sponsored, bill participation, term count, and the number of parliamentary committees they sit on. This section provides a transparent view on each legislator's contributions and activities. The Finance Tracker. This consists of two powerful tools, the Budget Tracker and the Debt Tracker. The Budget Tracker displays the current budget allocations of Uganda, allowing you to track how public resources are distributed across various sectors. But that's not all. There is also the Budget Simulator tool, enabling you to actively participate in the budgeting process by simulating your preferred resource allocations. While the Debt Tracker provides insights into Uganda's national debt standing, you discover key metrics such as the debt per citizen, GDP per capita, and per capita income, along with the sources of these loans. Stay informed about Uganda's financial health and the implications for future generations. Insights. This is a platform where you can gain valuable knowledge about parliament-related topics. Simply enter your queries and our system will fetch relevant articles and also provide AI-generated summaries, offering you a deeper understanding of the issues that matter to you. With its comprehensive tools, staying informed about Uganda's parliament and financial landscape has never been easier. Whether you're curious about your representative's performance, want to understand their budget allocations, or seek insights on parliament-related topics, this platform has you covered. Empower yourself with data and take an active role in shaping Uganda's future. Parliament Watch. Your eye on Parliament.
Welcome back to the Policy Digest. And as we continue with our conversation, I have a question for you, Dr. Obuku.
Yes.
So there's been questions on what value do medical interns add to Uganda's economy, not just the health sector, the economy itself, and why them being paid and us standing on their side is important.
Thank you very much. Interns provide over 70% of the labor workforce. Doctors, dentists, pharmacists, and nursing work. That's one. Two, if you estimate their cost contribution, one intern, let's just take a case study of a medical doctor, intern, who is supposed to do at least one cesarean section a month. That one is the one who is dodging. Okay? We'll do 12 cesarean sections a year. Now, if you multiply that by the 1 million cost of a cesarean section, which is really the one at Lacho Hospital, a missionary hospital, that's value addition of 12 million shillings they have added
to the economy.
They are now being paid 12 million shillings a year. So just by taking if an intern sleeps and wakes up, does one cesarean section on Monday, the first Monday of June, and every first Monday of every other month, and goes to sleep, would have worked in government cost neutral, meaning the money you are paying, they have returned it. So an intern just needs to work 12 times a year, once a month, the first Monday, and do cesarean section, one only. And we have recovered this 12 million they are calling a lot. And that is the doctor. Now, I've not even talked about the 50 actual cesarean sections they do. I've not talked about the 50 other operations they do. Whether it is debridement of a wound from a road traffic accident, okay? And other herniorrhaphies, repairing the hernia.
So, doctor.
Okay?
Yes.
Now, that would be another 12 million minimum. Okay? But I can tell you can see that is 100 surgeries. 50. That is 100 million already they have returned. Which means even only the 1,000 doctors, if they work, okay, and each contributes value of 100 million, okay?
Yes.
Times 1,000. Isn't that 100 billion? Now, if it is 100 billion, And what we are asking for those interns who are 2,000 is 24 billion. They have multiplied that money. Amagoba are 5 times. Which business gives you 5 times in Uganda? If you get a 30% profit net of tax, you celebrate.
Yes.
But here you are getting 500% profit. And this is only from the doctors. Meaning that, economically speaking, even if you pay all the interns and the doctors work very well, and the pharmacists sleep, and the nurses sleep, okay? The money generated into the economy by the doctor interns alone can pay for those guys to go on holiday with 1 million shillings every month. Now, if you add the value of the other 1,000, I think it is also 100. It is also another 100 billion. Economically speaking, if you extrapolate that someone has gone back to work to the coffee farm and is the one actually now exporting that coffee because the intern attended to them. So you can see that interns alone are contributing at least 200 billion into the economy. And you are paying them 24 billion, my foot, and you say it is expensive. You show me the direct value added into this economy by an MP or a minister. The direct value which you can say he treated someone and saved the mother. The mother went back to work a cassava garden, she dug. Or the family breadwinner broke a leg, treated, he has gone back to work. Or the border had a head injury, the intern attended to has gone back to work.
So, doctor, in your view, it's more of political will to invest in medical interns?
Lack of clear policy analysis and understanding where the intern fits in the wheels of the economy, in the grand scheme of things. How does the medical intern make the economy go round? And this is why on August 13th, 2016, at Imperial Royal Hotel, the first Grand Doctors Conference and Fellowship Dinner, where we invited Mr. Museveni, and we asked the interns, speak to him, Dr. Byamukama Onesimus, and the senior house officer, Dr. Chaze Isaac, speak to him. Once the president had said, what is this modern day slavery in my regime? Man, after 35 years, the man was discovering there were people who are working and not being paid at all.
Modern day slavery.
So that value, we showed the president that 350 senior house officers were adding to the economy $13 million every year. Okay? The good thing we have an economist who believes in the economics that works, Dr. Ramadan Govi. Himself, he said he's saving 24 billion by limiting sponsorship of these public holiday celebrations. And I'm sure he can cut, if he had started early and cut 115 million from the MPs, he would have even saved twice that.
Yes.
You get? And other places we don't know about. Wastage in classified expenditure. The president could do a better job with the people he trusts. He doesn't have to show us the budget. In that classified expenditure, the president can do a better job in the trillions going into defense and security in classified expenditure and make that leaner, bring it to us. Look at other expenses. What value has Atiak Sugar returned after investing 666 billion? No kilogram of sugar. Even. And yet, Honorable Bahati, Minister of Trade, said this year we are going to see the first kilogram of sugar. The most expensive in heaven and on earth. 666 billion to see sugar. Let's talk about Day Farmer. 723 billion given. I heard they are manufacturing metronidazole. Metronidazole is the cheapest, even with 1,000 you can get a full dose. If they were manufacturing things we don't have, Ebola vaccine, you say, we are moving. Yes. Malaria vaccine, very expensive. Much as we are forced to buy it. Okay? Anti-malaria medicine, this is the one. Malaria is killing 16,000 people per year estimates. But we are recording 2,000 actual who come to hospital. That is something we should invest in.
So,
you
doctor,
get? When you talk about to other places where money is wasted.
Yes.
Okay? Luboa Hospital swallowed how much before it was put up? Over 200 billion. This Inspire Coffee Africa. When I go to the supermarket, I always look, I say, where is the one of Inspire Coffee? Where I paid my tax, 180 billion. Zero. A colleague, Muramuzi, who is a nurse, Secretary General of the Nurses Association in Uganda, we were conversing. I said, by the way, you said you're a coffee farmer. This one of Inspire Coffee is where? Said, they are also trying to struggle to collect from farmers. What are we up to as a country if we are going indeed to leap into the middle income status, the middle? The $500 billion economy is going to come how? Without human capital at the center of it. With investing to what Andrew Mwenda called conmen. He called him conmen, Mr. President, much as he apologized, but he had let the cat out of the bag.
Out of the bag. So, Doctor, investment itself, how are other countries? Let us go just close our neighbors. How are other countries investing in their medical interns?
By the talk about East Africa, if you don't pay medical interns, you will be the only country in East Africa which does not pay medical interns. And you know, the East African community, we're talking about the common protocol. We started with the customs union, moving very well, 2005.
Yes.
2013, common market. Isn't it? We signed that one. You know, movement of goods, services, people, and so on. Okay, free. Common market. We talked about a monetary union, which was supposed to come in two force. I think that is the one of 2013. Maybe the common market was 2010. Then a political federation, 2023. Isn't it?
Yes.
How are we going to achieve the East African commonality if Kenya is paying 7 million to its intern equivalent? And the Ugandan here is not being paid? They will all run to Kenya and destabilize the market. Isn't it? Rwanda is also paying. Tanzania is paying. Even the DRC is paying. The one in war for all these decades. Even the South Sudan, the baby is paying. Somalia is paying. Okay?
Yes.
So how can Uganda, which we are saying Uganda now, the president always says, our economy has grown 17 times.
And we can't afford to pay for.
So why hasn't the salary of interns grown 17 times?
So, Doctor,
isn't it?
Yes.
So that we move proportionately.
With the economy
Isn't
that
it?
is growing.
So please, let us align our political rhetoric with action on the ground. Don't say the future is the youth. We are securing your future. Okay. Securing your future. We increased the money of interns. We have a letter, by the way, of 2021, signed by the president, the blue letter, where he increased the money of interns from 750 to 2.5. He said, once he understood the work, he said, now, how much does a starting doctor get? 5 million. Therefore, let's start the interns with a half. Otherwise, they are also supposed to get 5 million. But he wanted to test. And instead, these technocrats deceived him. You know, he's a muzee also, Judge. Eite. Judge also doesn't want to quarrel, doesn't want to, tabula his own team. He comes back to 1 million. After they have deceived him. Wrong political calculations. Let's do politics of service delivery. Any president, whether it's Museveni or Chagulanyi, once you give service delivery, or Dr. Besigye, once you give service delivery, or Jimmy Akenda from my UPC, once you give service delivery, the people don't care which party you are, which tribe you are, what age you are as president. But once there is no service delivery, that's when they start saying, oh, everything is going to this region. For us, we are missing. Oh, only the elders are giving themselves crazy retirement packages. You have seen this political leader.
Yes.
Drawing a pension here. Why do you give someone who is above 65 a 4.5 liter cc guzzler? To do what? When that guzzler is 500 million government buying.
Yes.
Elsewhere it can be 200, but the government buying you, everything you are buying 3 times. 3 of them are in one. When the youth, we are saying youth have no jobs. But we are investing in retirement packages so much. I'm not saying don't give them, but you invest so much, someone cannot even move into the vehicle.
Okay, so Doctor, you've talked of service delivery, youth employment, and then you also talked of us being the only country that will not be paying its interns.
Yeah, which is against the East African Common Protocols. Yes.
And which you say that will end up some interns or doctors moving to Kenya.
Market forces.
So
demand and supply.
Yes. So, Doctor, there's been an issue of the fact that doctors migrate from Uganda to other countries for sake of better jobs. With such policies in put in question and some even put into practice, where does that leave the medical doctors?
Two things. I have a quarrel with WHO. WHO has classified us as a country which does not have enough health workers.
True or false?
So I have it is true and false.
Doctor.
Yes, because the health workers are now enough. That ratio of 125,000, if you calculate very well, is not correct. The problem is they are not absorbed into the formal working systems.
Just to stop you there, Doctor, what do you mean by they are not absorbed into the
They are not
formal?
employed. There are many doctors walking on the street. There are many nurses walking on the street.
So them not being in the system and being able to work on patients, doesn't that mean that we still have a shortage of medical doctors?
Yes,
who can
it is
actually work on
artificial. And therefore, if government has refused to employ these people, if the private sector is want to employ them with peanuts, maybe because the economy cannot sustain the very wonderful salaries, let WHO declassify us so that we can officially functionalize our Uganda Medical Association labor export company, which we have registered, so that we export doctors and they earn a good living. After all, there is no loss. They will remit that money which the sovereignty bill wanted to stop. It is competing with gold, it is competing with tourism, it is competing with coffee. That money. And if you send highly skilled doctors and you have helped them in a patriotic way, they will send that money to their families. That is number one. In East Africa, as I said, we will be the only ones. Okay?
doing that.
The number of doctors has increased so much. While they are needed, there are no incentives. If as government you cannot manage, permit International Hospital Kampala, Nakasero Hospital, anybody who is qualified as a specialist and has a reasonable medical center to take 1-2 interns. Pay them. Okay? And we make this economy work for everybody. By the way, that intern, the mother is selling in the market. The father is a border. I saw an intern, a medical doctor whose father is a border rider. And I was so proud to see that a person who rides a border can pay school fees for his son or daughter to become a doctor. So don't think this money you are giving, he's not helping his father or his mother to pay school fees for the siblings. You are imagining those days where only doctors' children would come to medical school or ministers' children. Nowadays we have the common Ugandan we always make policies for, okay? Of UPE come over to become internship, of USC to become internship. And these leaders, my challenge to you, you are saying term no corruption, term no sleep. Can you send your children and your wife and your husbands to Mulago to get treatment? Or to Arua Hospital? Or to Lira? Or to Apache? Let every MP start by sending their children there. When they say, I'm feeling bad, send there. That is the time we will have these MPs from Karamoja send their children and their wives or husbands to Moroto Hospital
to get treatment.
The other day, Soroti was closed. The speaker was from Soroti. Big people like Mike Mukula are from Soroti, who was the vice chair of what? Of NRM. Rich men like Ochodu, who is now coming to become minister of I don't know what. NRM, they are from there. How can Soroti Theatre close even for 1 hour? You get what I mean?
Yes.
Because their children are in America.
And they don't have to worry
How
about
can we have sincerely ministers to serve the people? And they are citizens of America. They don't love Uganda, those ones, even if they speak good English. They are there for service. They are there to earn some money. They are there to feel good. None of those ministers who have sent the children to America is going to worry about the UPE child who has no computer. Why is that important? Because education has been shown to improve preventive health. So much as we are here interns repairing health, really the challenge is preventive health through education. You remove ignorance, fighting poverty through youth employment, including interns, by the way. That should be the youth program for health. So government is anti its youth skilling program. So it's working against its very policies in the Ministry of Gender.
So, Doctor, if you were to sit, who drafted this policy to start with?
I don't know who drafted it, to be honest. But I was in the drafting team in 2017 when it started at the Ministry of Health. But then it disappeared because we have ascertained no important stakeholder was consulted. The Secretary General of Pharmaceutical Society said he was not consulted. The President of Interns, that is Dr. Lutot, the President of Interns, Federation of Uganda Medical Interns, Dr. Monda, said he was not consulted. My President, Professor Bavinda, said he was not consulted. The Dental Association President was not consulted. We asked Vice Chancellors of universities. They were very annoyed. Deans of medical schools, they said, how can you treat us like we don't matter? Article 38 is clear of the Constitution, how a policy is developed. And we are also cognizant, I think, of Article 155, how a budget is developed. The president is the de facto Minister of Finance, delegates. This is why we would like to meet the president. And we discuss matters of finance. Please don't block us, you people. People like blocking us because for them they have access to Muse. And by the way, I'm not working for government. But I must fight for the profession because I know next time I have an accident, I will end up in Kiriadongo on my way home today.
Yes.
I may end up in Luwero where the freedom was fought for. You go to that hospital, is lacking, this is lacking, the other. But that is the maker of NRM. Sincerely, if we are to judge the 40 years of NRM, we should go to Luwero and see what is there. What is the Human Development Index of Luwero? How many doctors are there in Luwero? How many nurses are in Luwero? How are the schools in Luwero? How many coffee farms are irrigated in Luwero? How is the common man? People in Luwero should be... because they died, they said, to remove our brothers, the Obotes.
Yes. So, Doctor, I have two follow-up questions. That is, you said that the bill was drafted in 2017 and disappeared midway.
Not the bill.
The policy,
we had a mega strike.
In 2017.
You may have been in primary school. But I was the president. We shut down the country for 3 weeks. It was serious. And me, by the way, I've never worked for government, apart from internship. But I was the president, merely coordinating and speaking. What the government consultant and the government medical officer may fear because of public service standing orders, they will just remove you from the payroll. And that is the unfortunate thing. Some of these leaders of ours are doing, they are targeting some doctor leaders and removing them from the payroll. My advantage why doctors selected me as Secretary General at that time is I was not in government. So I was part of that team initially. We put pressure. Government said, let's have a policy, two policies, medical internship and senior house officers. Why do they need a policy? Because government itself removed them from the payroll. If they were in the payroll, all this nonsense would not be there, and the confusion. You are getting me?
Yes.
And you are paying them 1 million. 1 million for someone who doesn't see sleep for 3 days? You read 5 years, 2 degrees in one, and they give you 1 million, and
now they don't want to pay you.
They want to say, we are helping you. So this country belongs to all of us. The taxes collected are on our behalf. The loans borrowed are on our behalf. Yes. It is just fortunate that whoever is in power today, including ministers, are there by virtue of being born before the people who have been born in the year 2000. They are coming, and we are teaching them how they should treat us when we are retired by squandering and leaving for them nothing. They will squander and we will suffer.
So, Doctor, back to the question. The policy was drafted in 2017, disappeared, has come back this year.
Has come back in a terrible state.
All right. So if you were to sit in the same room with someone or the group of people who drafted this new policy that has been tabled, what 1 or 2 words would you have for them?
I'll tell them, 1, the policy is dead on arrival. Because a policy must be owned. Every policy lesson that I teach, we talk about stakeholder engagement. For buy-in, you are not doing interns a favor, you government. You are not doing interns a favor. You have a responsibility. The president said, if you cannot work for the people, leave the office. You know you are looking at 2,000 interns, but those 2,000 interns handles at least 100 patients. 2,000 times 100 is what? 20 million or 2 million? Handles at least 1,000 patients. I want to now factor in.
Yes.
The interns will handle at least tens of millions of patients in the next 12 months. So you are affecting the taxpayer, you are affecting the voter. That's why you have to go back and bribe and do, because you are neglecting service. Actually, I will quote the General Sejus who said, the people refusing to pay interns, the technocrats, are subversive. Don't even go and look for ADF. The ADF is within government. People are saying interns are going to strike. No, the strike started. The strikers are in government because they are sabotaging government's ideals. Socioeconomic transformation, youth empowerment, women empowerment. There are also women there who are intern doctor. You know, we don't even have opportunity to sit down and say, how should a woman who is an intern doctor be treated if she becomes pregnant? We were supposed to, by this time, 10 years down the road
be
after
having
the
a
strike,
different conversation.
be having a different conversation of refining that if you're a woman, you give birth as an intern doctor, these are the terms. We will extend by 6 months because we have to give you leave, but we will pay you. This is how sophisticated we are supposed to be. But that conversation cannot start. This business of her supervisors there, that conversation cannot start when they are hungry and angry. Let's solve Maslow's hierarchy of needs. 1, food, shelter, clothing, and better working conditions. And motivational factors of Herzberg, the 2-part theory. What motivates the money? After money and they have sorted the basics, we can talk about these sophistications of quality.
So, Doctor, as we conclude, what's the way forward? And if you are in Form 6 as of right now, and this is the policy that will be used to, in your period when you are a medical doctor, would you still do medicine? Yes.
If I was in Form 6 observing, I would be discouraged.
To do medicine?
To do sciences. Because our leaders are deceiving us. Okay? They are promising water. Sorry. We are supposed to all, they are choosing to give wine to a few instead of water for all. You get what I mean? Yes. This is the saying by Thomas Sankara. Either we give champagne to a few of us or drinking water to everybody. Safe drinking water. So the national cake, this prosperity we are talking about, including betting on futures of oil, earning money before it comes from oil, the ground. Yes. We are squandering it on unfair distribution of priorities. But as me, Obuku, and other people in the sector, we are going to fight to make sure that our children and grandchildren get even better opportunities than we got. I told you, I flew on a government money ticket to Arua as an intern. I was paid very well. I had no need to complain or watch Arsenal. Okay? The final question was?
What's the way forward?
The way forward. We have talked about the way forward. 1, cut money from non-priorities. Clothing of government. I saw the Director of Parliament, Communications, had spent 800, almost $1 billion on clothing. Okay? The Parliament budget has doubled into trillions. I doubt they can use that money. That's why they had to take it out of CSR. Let Parliament steal money and do corporate social responsibility. Cut money, give us the money. The rest, once you give us the money as government, issues of quality, Issues of standards, we shall sort out ourselves. We are a self-governing profession. We have an act, Uganda Mental and Dental Practitioners Act. The Pharmaceutical Society of Uganda has an act. The nurses have an act. We will regulate ourselves. Help us with the two things. Give us the money. The professors are there, who are doctors and nurses and all. The senior consultants are there. We will sit down and sort ourselves. For as long as there is no money, however brilliant the idea is, it cannot be turned into action. These are words of Brother Leader Gaddafi, who made a lake in the middle of a desert. So if we are to turn internship into something very good for the Ugandans who have voted,
yes,
and expect a lot from the sitting government in power, involve us. The health sector is not Ministry of Health. The trainers are not Ministry of Health. Involve the actual people on the ground to make decisions. Means we should just coordinate. Thank you very much.
Thank you very much. And it was such an honor to have you, Doctor, as a guest to this podcast.
You're welcome.
Yeah. Thank you very much for watching. This was the Policy Digest, and I'm Justine Safari. To watch this podcast, watch it on all our social media platforms at SEPA Uganda, Home of Parliament Watch Uganda, on YouTube, TikTok, and X.
Thank you for listening to the Policy Digest podcast, the Center for Policy Analysis podcast that is profiling African ideas and people that are shaping the future of their communities. Subscribe to all our platforms on YouTube and Podbean.